So we are seeing a rise in cases, and this will be the 6th time that we've seen a rise in cases. I think it's a matter of debate whether we call it a wave or a swell or what have you, but it is the 6th time. So I'm calling it, for now, a swell wave.
What is immune escape?
Immune escape is when you have immunity to something from a natural infection or vaccine-induced immunity, and then you meet a version of the virus again, and the virus can get around the immunity that your body has built up. That's sort of the simplest way to explain it.
And are we starting to see more immune escape with these new variants coming out?
What I can tell you about the new variants coming out is that each new variant, at least within the Omicron family, and before I would say, seems to have a growth advantage in that it spreads more easily than the previous one. So that's why you see a new variant come, and then it sort of crowds out the variant that had been predominant before. Until another variant emerges that has a growth advantage over that, and then it overtakes. And so we've gone through several cycles of this, and the currently what we see is BA2 and then a subvariant of BA2. And both of them spread much more easily than the original Omicron that caused the big surge over the winter.
Yeah, I'm looking at your slide deck that you presented to the supervisors. So each one becomes more transmissible than the last. It's 50% more, and then it's 30% more on top of that, and then 25% more on top of that. As a layperson, as a normal citizen, to me, I look at that and it seems terrifying.
Well, you have to remember the job of a virus. The job of a virus is to find a susceptible host. And so there's going to be a selection for the virus that can spread more easily and find more hosts. And that's indeed what this virus is doing. I think it's important to remember that we have a very high vaccination rate in Santa Clara County and a relatively high booster rate. And that's important because it keeps it, even if you get infected, being vaccinated and boosted protects you from severe illness and hospitalization and death. And that's really, really important.
We're now 2+ years into this. What is the biggest challenge now? I think you mentioned one of the battles is the battle against complacency.
Yeah, I think, it is certainly understandable. Humans, we can't keep at something for 2.5 years. You can't be vigilant for 2.5 years in a row. And we need breaks, and we need to connect with other people. And, we need to do, we need to do a lot of regular activities. So I think we can do all of those things. But we still are in a pandemic, and so there still are precautions that we need to take. And I think we can do those things without significant disruption to our lives. So what we've talked about for a long time, as you know, is layers of protection. And when community transmission rises, we need to add extra layers of protection. So for example, if folks had begun to relax in March and April and had stopped wearing masks indoors, now is the time to readopt the practice of wearing masks indoors, particularly in crowded public indoor spaces.